is not for me. I quickly realized that hospital nursing was not for me. So I transitioned to working as a school nurse in Baltimore City. I was in a high school for about 4 or 5 years. And then during the pandemic, I got out of Baltimore, sold everything I owned, and moved to Delaware, wanted to live at the beach, and began working for Delaware Public Health, where I'm currently in my role here. So right now I focus on staff development for our community health nurses and our advanced practice nurses. I teach CPR, and I occasionally provide public training sessions like Narcan and Stop the Bleed, and conduct presentations like this one. Outside of work, I do some traveling, I walk on the beach with my dog, and I like to spend time with my family. As in this picture here, you can see me hanging out with my mom in Jamaica. So in this presentation today, we'll explore key topics in sexual health and STI and HIV prevention strategies. I'll begin by sharing the latest STI and HIV data from the 2023 CDC surveillance report, which is actually just published a couple weeks ago. And we will review the services that our public health clinics provide in Delaware, including we'll also talk about where they can be located throughout the state. And then finally, we'll discuss the specific medications that are available to individuals for preventing HIV and sexually transmitted infections and diseases. As we'll start with some data on STIs. So in 2023, there were over 2.4 million cases of chlamydia, gonorrhea, and syphilis that were reported in the United States. The most concerning trend is the significant increase in syphilis cases. We noticed some gonorrhea cases declined for the first time in a decade. So this data all comes from the surveillance report, which was just issued on November 12th. And over the past decade, we've identified that bacterial sexually transmitted infections in the US, including chlamydia, gonorrhea, and syphilis, have shown a concerning upward trend. This chart here will highlight the total reported cases from STIs in 2014 and 2023. Chlamydia consistently accounts for the largest proportions of cases, surpassing 1.5 million annually, underscoring its prevalence. Gonorrhea follows with steady increases over the years. And the most alarming thing is the syphilis cases. Though they're small in comparison to the other sexually transmitted infections, their significant increase is an alarming factor, and we need to heighten our public health interventions. And we'll break it down to the individual cases here. So all these graphics here are available on the CDC. So if you yourself are involved in any type of education to the public, I highly recommend the CDC. They just released all of these new graphics. They're really great. So they call this the state of STIs in the US for 2023. So in 2023, we had about 600,000 cases of gonorrhea, which is a 2% decrease since 2019. 1.6 million cases of chlamydia, a 9% decrease since 2019. And our most alarming thing is syphilis cases, which increased 61% since 2019. And congenital syphilis, 3,882 cases among newborns, so 106% increase. When we talk about congenital syphilis, it's the syphilis contracted by infants from the pregnancy. So the rise in congenital syphilis cases in the US is primarily attributed to a lack of timely syphilis testing and treatment during pregnancy. This is often due to the inadequate prenatal care and social and economic barriers like poverty and the lack of health insurance. And then we have this is further compounded by the inconsistent access to STD services. There are missed opportunities to prevent newborn syphilis during pregnancy. And this, again, due to that combination of individual and system level barriers to treatment and testing. When we look at specific data for Delaware, the CDC reports have been broken down by state. So in Delaware, there were 5,700 cases of chlamydia. So we ranked 12th nationally. Gonorrhea, we had 1,567 cases. We ranked 26th nationally. For primary and secondary syphilis, 180 cases, so we ranked 18th there. And congenital syphilis, we had 5 this past year, and we ranked 32nd in the country. So now we'll shift over to discussing our HIV prevalence in the United States and in Delaware. This is a really cool image here. You can see the human T cell, which is the blue one, is under attack by those little tiny cells, and those are the HIV cells, so the yellow ones. So the virus that causes HIV is the virus that causes AIDS. So the virus itself specifically targets these T cells, and the T cells play the critical role in the body's immune response against bacteria and viruses. So when people that have HIV or AIDS contract a general cold, they may have a hard time getting over it because those T cells are being attacked by the HIV virus. Okay, so again, all graphics from the CDC, and this is specifically from their Ending the HIV Epidemic campaign. And our data has not been updated yet for 2023, like all of our STI data. Our HIV data stays from 2022. So in 2022, we have an estimated of 1.2 million people living with HIV in the United States. And for every 100 people that have HIV, only 87 of them knew their status. So the CDC has this goal that by 2025, that people who receive an HIV diagnosis increases to 95% and then remains at that 95% by 2030. And then in 2022, there were 31,800 estimated new HIV infections. And of those, 67% were among the LGBTQ community. More specifically to gay and bisexual men who report male-to-male sexual contact. And 22% were among those who reported heterosexual contact, and 7% were among people who inject drugs. And another CDC Ending the HIV Epidemic goal is to decrease the estimated number of new HIV infections to 9,300 by 2025 and 3,000 by 2030. So it's a very ambitious goal, but we can get there with the incredible drug like PrEP. And we'll talk about that in a little bit. So some data specific to Delaware. We currently have, well, this data is that was released in September 2023. We have 3,932 people in Delaware that are currently living with HIV or AIDS. And in 2022, there were 124 new infections that were identified. So we do have some great data on HIV testing that's been done in Delaware. And this data comes from the 2022 Behavioral Risk Factor Survey. Excuse me. And this data showed us that 40.6% of Delaware adults have been tested for HIV at least once. When tests are being done, the most prevalent population is those among 35 to 54. And among adults, young adults aged 18 to 24, only 22% report having been tested for HIV. We can't emphasize the importance of getting tested. Everyone should get tested. So when we talk about the age of who should get tested, it's everyone 13 to 64 at least once. It's one of the most important things we can do to encourage sexually active people to stay safe. First, it's important to know that many HIV tests are quick, free, and usually painless. The CDC recommends, again, 13 to 64. And you should get tested at least once a year if you're a man who has sex with other men, or have had sex with somebody who has HIV, or have multiple partners, or shared needles or syringes. Some additional risk factors are people that exchange sex for money, having another sexually transmitted infection. So somebody who has HSV or HPV, they should get tested yearly. And gay and bisexual men may benefit from testing every 3 to 6 months. People that are pregnant or planning to be pregnant, it's especially important to get tested to protect your baby. And testing is widely accessible through a lot of free programs on this graphic here, which also can be obtained from the CDC. You just go to this website, gettested.cdc.gov, or you can call the 1-800 number and they can link you to testing services. Okay, so now that we've covered the prevalence of STIs and HIV in both the US and Delaware, let's shift our focus to the Delaware Health and Social Services Organization. Specifically, we'll explore the Division of Public Health's initiatives that are aimed at keeping Delawareans healthy. I'll also provide an overview of the services that are available to clients at the DPH community clinics and share information on where these clinics are located throughout the state. When we talk about Delaware Health and Social Services in itself, it's an overarching agency that manages 12 divisions, with DPH being one of those divisions. Our DHSS mission statement is to improve the quality of life for Delaware citizens by promoting health and well-being while fostering self-sufficiency and protecting vulnerable populations. And our vision is together that we provide quality services as we create a better future for the people of Delaware. So now we'll talk about DPH specifically. So our DPH specific is a little bit more broad, and our mission statement is to protect and promote the health of all people in Delaware. And our vision statement is healthy people and healthy communities. So pretty straight and simple. Let's see, these are just a few of the services that DPH provides. So community health, like I'm talking about, I'll get into that a little bit more. Epidemiology and health data. So that's our division that's responsible for getting us yearly data on different diseases throughout the state. Disease prevention and health and wellness promotion. For example, one of our health and wellness promotions right now is we have a cardiac program. We're trying to get people out into the community to discuss cardiac health and do health promotion like dieting and making sure to check your blood pressure routinely. Okay, our DPH clinic sites, these are our clinic sites that are in Sussex County, and all of our clinics are located at our state service centers. So in Sussex County, we have the Thurman Adams State Service Center in Georgetown. That clinic specifically offers child wellness, immunizations. We have a sexual reproductive health clinic there, and we also have a TB clinic. And then the Pyle and Shipley State Service Centers offer the same services, except they do not have TB clinics. The only TB clinic is at the Adams State Service Center in Georgetown. In Kent County, we have the Milford Riverwalk location and the Williams State Service Center. Both of these locations offer child health and immunizations programs, and also our sexual and reproductive health clinics. And the Williams State Service Center also has a TB clinic. Lastly, we'll talk about Newcastle County, and we have two clinics there, the Porter State Service Center and Floyd Hudson State Service Center in Newark. Both clinics offer vaccination services and child wellness and reproductive and sexual health. And then we also have a TB clinic at the Hudson State Service Center. And a new initiative that we just started within the last 2 years, we have mobile health services. We actually have 3 trailers that go out into the community 3 to 4 days a week. We have 2 nurses on that mobile unit at all times, and they can do cholesterol screenings, HIV testing, lead testing, and vaccines. It's great because they set up in low socioeconomic areas, completely free service. You do not need insurance. And if, say, cholesterol screenings comes back and the readings aren't great, then that nurse can connect the individual with follow-up services. So it's a really great service that we're now offering. If you're interested in learning more about our mobile health services, feel free to send me an email and I can get you onto the distribution list, and they'll find out where the mobile units will be set up throughout the community. Now we'll talk a little bit more about the services that are offered in our DPH clinics. So we offer child health, and that includes our well child visits for school entry. So children can come in and get a physical done by our nurse practitioners. So check them off for school. They can get all their school-based vaccines. and our reproductive and sexual health clinics, and we have our TB clinics. Our TB clinics offer care for people who are diagnosed with active TB or latent tuberculosis. All right, so our RSH services, our reproductive and sexual health services, in our DPH clinics, we offer family planning, STD and STI testing and treatment, HIV testing. We offer NPEP, which is non-occupational post-exposure prophylaxis, PrEP, which is pre-exposure prophylaxis, and lastly, our new service, which is Doxy PEP, and we'll get into that in a minute. So why I really like to promote our RSH services is because you can get PrEP, Doxy PEP, and NPEP online through a provider, and they've made it very simple through services like HIMSS. And it's great that these programs exist, but they really only cater to people who have insurance. And that can make it difficult for some of our Delawareans. So our DPH clinics serve those without insurance. And our DPH clinics also provide comprehensive services, including those STD and STI testings and pregnancy testing. And we can connect individuals to local support services, whereas an online company offering those medications cannot really support you like that. So some of our family planning services that we offer is birth control. We can also conduct pregnancy testing. We have condom distribution. We have condoms in all different colors, shapes, sizes for male, females. You don't even need an appointment to come in to get condoms if you want. Just walk in and grab a handful. We also have options counseling, so morning after pill, and we can connect you to our social services like WIC and Catholic Charities. And lastly, we have disease intervention support specialists. We talk about the specific things we can test for in our clinics. We have screening and testing for bacterial vaginosis, chlamydia, gonorrhea, syphilis, genital herpes, HPV, trichomonas, hepatitis B and C. And our HIV services, we can do point of care testing and counseling. We can also do lab confirmation testing through blood draws. And then lastly, we can have referrals for treatment for clients. And every STD, STI that we test for in HIV, we have treatment for, or if we don't, we refer out for services. Like, for example, hepatitis B and hepatitis C are very specialized care. So we would refer you out to a provider for that. So now we're going to talk about our medications for prevention. So first one we'll talk about is non-occupational PEP, or post-exposure prophylaxis, which is a treatment for potential exposure to HIV during an episode of unprotected sex, needle sharing or injection drug use, or exposure to blood or body fluids of a person with HIV. So I want to be clear here to emphasize that NPEP is for people that are not working. So where this would differ is, say if you have a nurse who has an exposure to somebody potentially as HIV, like maybe they had a needle stick injury, they would not go through this same process. They would go through the emergency room, and it's considered different, or they go through their employer to get services. When we're talking about non-occupational PEP, it must be started within 72 hours after a recent possible exposure to HIV. And the exposed person with existing HIV infection would not be a candidate for NPEP. And lastly, a medication adherence is vital. So you have to take this medication for the regimented 28 days, and you have to take it every day for it to be effective. Whenever we prescribe NPEP in the clinic, a comprehensive sexual health approach is taken. So I want to also emphasize that if somebody has an NPEP exposure, they can walk right into any of our clinics. So just keep in mind that our clinics are only open for 8 a.m. to 4 p.m. So it may be a little dicey when it's on maybe an occurrence on the weekend, but we always encourage people, as long as you come into our clinics and start this medication 72 hours after the known exposure, then you'll be okay. So we So again, we have a comprehensive approach when this medication is prescribed, which includes baseline laboratory studies. And if a rapid HIV test is positive, we do not start the person on PEP, on NPEP. The medication is taken twice daily for 28 days, and the medication is typically Truvada and Icentris. The medication might be modified if somebody has impaired renal functioning, but these are the two drugs that we have in our clinics that are available. And lastly, we have risk reduction counseling, where an individual will meet with a disease intervention specialist and learn about those. Now we'll discuss PrEP, which is pre-exposure prophylaxis. Now, this is medication taken before any type of sexual encounter. And this is recommended for individuals who are HIV negative and have had anal or vaginal sex in the past 6 months with a sexual partner who has HIV, inconsistent condom use, or a recent STI diagnosis. It's also recommended for individuals who inject drugs and have an injection partner with HIV. They share needles, syringes, or other injection equipment. And lastly, PrEP should be considered for those who have been prescribed NPEP in the past and report ongoing risky behaviors, have used multiple courses of PEP, and anyone requesting HIV PrEP. I want to underline that last statement again. Anyone requesting HIV PrEP. If somebody wants PrEP, they should be able to get it. The barriers to PrEP have been reduced so much, but if a patient has a provider that will not prescribe them PrEP, then they should come to one of our clinics or frankly get a new provider, because there's no reason why somebody should have PrEP unless they are for some medical reason that they can't obtain it. So when PrEP is offered, again, when it's prescribed, we conduct a comprehensive sexual health approach. And this includes baseline laboratory studies with follow-up every 3 to 6 months. And the medication for PrEP that we prescribe in our clinics is Truvada. There are others. And we do the risk reduction counseling. It's important to note that once an individual is on PrEP, rapid HIV testing can no longer be performed. And the reason for that is that rapid HIV testing is not typically used for people on PrEP because it may not accurately detect a recent HIV infection due to the potential delay in antibody development caused by the medication itself. So this often can lead to a false negative result and may miss detection of HIV. Excuse me, it may miss a detection of HIV. All right. So lastly, we're going to talk about doxycycline, or Doxy PEP. And this is an antibiotic that we use for post-exposure prophylaxis. It helps prevent bacterial STIs after a sexual encounter. And it's currently being studied and has been studied for prevention of gonorrhea, chlamydia, and syphilis. It's important to note that this drug does not provide any protection for viral STIs, so it will not protect somebody from HIV, HPV, or herpes. The medication, as in the type, is the name Doxy PEP, says it. We use doxycycline as a prescribed medication for Doxy PEP. The doxycycline's actually been around since 1967. It's a widely available and inexpensive medication, and it's been utilized for post-exposure prophylaxis for a while in treatment for a variety of disease conditions. For example, if we have park service members, people that have been bitten by a tick, it'll often be prescribed to prevent Lyme's disease. When we prescribe Doxy PEP, it's prescribed as 200 milligrams. That is ideally to be taken 24 hours, but no later than 72 hours after condomless, oral, anal, or vaginal sex. A single dose is often sufficient, and it can come in various forms. So picture here, you can see it as a single tablet of 200 milligrams. It can also be prescribed in a 100 milligram form, so the individual would just take 2 tablets. It's important to remember that doxycycline should never be taken in doses exceeding 200 milligrams within a 24-hour period. Let me go back for 1 second. What we typically like to tell clients when they're prescribed doxycycline is if you're going to be, say you have a promiscuous weekend planned, okay, so you say you go out, you had a sexual encounter, you go ahead and pop your Doxy PEP, take your Doxy PEP dose for that day, and it's a Saturday, but you know tomorrow's Sunday and it's Sunday tea, and you may be promiscuous again that evening. You can go ahead and take your doxycycline again. Just remember to not take it more than 24-hour period. I'm sorry, more than 200 milligrams in a 24-hour period. We also, when we prescribe Doxy PEP, take a comprehensive sexual health approach, which includes laboratory testing at baseline and every 3 to 6 months. We conduct counseling on risk reduction strategies, so making sure to still wear condoms and being safe. Linkage to HIV PrEP or HIV care is needed, so doxycycline and HIV PrEP can absolutely be prescribed together. And an ongoing assessment of the need of Doxy PEP is conducted every 3 to 6 months. And when we talk about baseline testing for this drug, anybody that's about to be prescribed Doxy PEP should have an STI and ST testing at all the anatomic sites for whatever sexual activities that they partake in. So doxycycline, the studies that are available now, there's not too many, but there are a few. And I will put the links to these studies in the chat in 1 second. But the studies have shown a significant reduction in the risk of STIs for those who take Doxy PEP after unprotected sex. In controlled trials, they've seen a reduction of syphilis cases by 87% and gonorrhea by 57% among high-risk populations. So very effective and very safe. So while these studies show the effectiveness in adults that have assigned male at birth, it has not been effective for individuals assigned female at birth. Just want to emphasize here that these are facts from studies that have been completed. It doesn't mean that the drug is ineffective for people assigned female at birth. It just means that the studies have shown the effectiveness for the specific individuals. I'm going to go ahead and post these studies 1 second. Maybe not. That's not working the way I wanted it to. I'll share them at the end of the presentation. Something to be mindful of when taking doxycycline, just like any antibiotic that's used over a period of time, the daily use of antibiotics can lead to resistance, causing the medication to become ineffective. So it's just important to remind the patients, don't take this drug every day, but take it if you are sexually active. So if you're gonna be sexually active every day for a week, then that's okay, take it, but don't take it if you're not planning to have sex or not having a sexual encounter. So again, there are ongoing studies evaluating Doxy PEP, including the risk for development of antimicrobial resistance. So any antibiotic taken daily can cause lead up to resistance, but we don't know the exact facts of using doxycycline as Doxy PEP yet. So a couple of adverse effects with these drugs, just like any drugs, they do exist. So with NPEP, or non-occupational post-exposure prophylaxis, we have 2 drugs that are prescribed. It's the Truvada and the Icentris. Both cause nausea, diarrhea, headaches, and fatigue. Usually those symptoms subside quickly as the body starts to get used to these medications. Just want to be on the lookout for those things. With PrEP, it's the same drug with Truvada and same type of adverse effects. Again, they do start to diminish after prolonged use. And lastly, Doxy PEP, it's an antibiotic that has sensitivity to light. So you just have to be mindful of how much sunlight exposure you have. If you're exposed to sunlight for prolonged times, it can cause severe sunburns and skin irritation. And like most antibiotics, it can cause nausea and diarrhea. So it's important to remind people to always make sure you take Doxy PEP after eating. And just to note, there are other antiviral medications on the market for PrEP and NPEP, but the ones mentioned are the ones that are offered in our DPH clinic. All right. Moved pretty quickly through that content there, but we're going to go ahead and do a little true or false activity here for a knowledge check. Let me just pull up my chat box here. So if you don't mind to participate in our little true or false game here, in the chat, if you could just put a T or F, or whatever you think is true or false. All right, so our first question, Doxy PEP is prescribed to treat bacterial STIs. True or false? All right. So yes, it's false. So Doxy PEP is a preventative treatment to reduce the risks of acquiring bacterial STIs after exposure. It is not for treating an active infection. If a client is diagnosed with an STI, another antibiotic would typically be used for treatment. Although doxycycline can be prescribed, the dosage would be stronger. It wouldn't be in the preventive dosage. One of the possible side effects of taking doxycycline is increased sensitivity to sunlight. All right, I don't have too many participants today, so let's move through. All right, so that one's true. So again, with the known side effect of doxycycline is a sensitivity to sunlight. So even some short periods of time of exposure may cause skin rash, itching, or severe sunburn. So just be mindful of that if you're taking Doxy PEP. Doxycycline is effective for preventing both bacterial and virally sexually transmitted infections.
Trying not to respond, see if we can get some other participants.
That's okay. All right, that one is false. So Doxy PEP is effective in preventing bacterial STIs only, like gonorrhea and chlamydia, but it will not provide protection against viral STIs such as HIV, HPV, or herpes. PrEP is only for people who are HIV positive. True or false? Thank you, Sequoia. All right, false. Thank you. So PrEP is for people who are HIV negative, but at risk for contracting HIV. So you do not want to give PrEP for somebody who is HIV positive. There are medications for HIV positive people to get them to a status negative, but it's not considered PrEP. Once you start PrEP, you do not need to see a doctor again for follow-up visits. Oops. False, right. So regular follow-up visits, we recommend every 3 to 6 months are required for PrEP users to monitor health, check for HIV, and most importantly, ensure proper kidney function. You must take the full 28-day course of post-exposure prophylaxis, or PEP, for it to be effective. True or false? So the answer there is true. The entire 28-day course must be completed without missing doses to achieve the expected efficacy of PEP treatment. All right. NPEP, or non-occupational post-exposure prophylaxis, can be taken anytime after exposure to HIV. Yeah, false. So NPEP must be started within 72 hours after exposure, and after 72 hours, NPEP for HIV prevention is not recommended. All right, so that's my presentation today from Delaware Health and Social Services. and specifically our Division of Public Health. And just want to give that promotion of it's your health, it's your choice, and to call your local Delaware Community Health Clinic and schedule to take the next steps in prevention today. Just want to emphasize how important Doxy PEP is now that we have this medication to prescribe to individuals. No longer are the days of somebody having an accidental exposure, like say it's condom break after an experience, at the rush to the state service center to get tested. They can just take a dose of their Doxy PEP. It puts the power into the clients. It gives them charge of their health, and it's really exciting. And I think it's a great move forward as we have this rise of STIs and STDs. It's just this one extra step that we can get people to get treated quicker and to prevent further illness or disease. And most importantly, spreading it to others.
Hey, Brett, this is...
Go ahead, I'm sorry.
Oh, sorry. Hey, Brett, this is Lisa, the Medical Society. I apologize. I'm like on my phone. It's the most wonderful but hectic time of the year. Will you be sending out like your contact information, because potentially there could be some interest from the Medical Society to have like, information that we could put in our newsletter or anything for physicians or for our community team. They might be interested in this as well.
Sure. I have it up on the slide right now for our contact information. If you aren't able to write it down, I'll follow up with David. Maybe he can send out a follow-up email for our contact information.
Or I have to say, if Sequoia is still on, Sequoia, can you shoot it over to me?
You can just send me an email and I'll follow up with you.
All right, sounds good. Thank you so much. This has been great.
Brett, are you there? Brett?
Yes.
Can you hear me?
I can hear you.
This is Jack. We met, you were on a Zoom call sometime in the past, and the subject is Doxy, right? And the question came up about online access, insurance, non-insurance, and so on. So my task was to follow up with Trinidad Navarro, insurance commissioner, and I talked with him. He was going to have somebody call you. There was some confusion, and I heard it again today about getting access online. Did anybody ever call you?
No.
Okay. I'll follow up.
I know there are free virtual providers without insurance, and then there's sometimes providers that will help with insurance. I just know it's not always easy for people, and some people may not be technology savvy. And that just encourages them more to come to our clinics, because you'll meet with a live provider that will sit in front of you and talk to you, rather than the quick paced environment that typically comes with those telehealth services. And you can get tested right on site. We no longer you have to get a lab report from that virtual provider. Then you have to go to a testing site, like a Quest Labs or one of the lab services. Or some of those online will also send you an at-home kit, so you can test yourself and send it in, which is nice too. But we can do this right in the clinic, get it done, do everything at a one-stop shop.
So it sounds like there's a lot more barriers to entry online.
There can be. I will say, if you have insurance, it's typically very simple to get up and running. And that's great too. It's great to have all of these sources for people to get to for this care. But yeah, when it comes to getting tested right then and there, it can get a little difficult.
So the subject or the barrier is insurance or non-insurance. How am I doing?
Oh, what's that? I'm sorry.
Insurance or not having insurance seems to be an issue, right?
Yeah, it can often be. That's usually the biggest barrier to people getting healthcare.
I think too, Jack, insurance, not insurance, but also there are folks that do have insurance, but perhaps that insurance doesn't cover the Doxy PEP. And it all kind of depends on the ICD-10 code or the billing code that the doctor uses too, the diagnosis that's used when prescribing that medication as to whether some insurances will cover or not cover. So
I will add that that's a good point, but I would add that if your insurance does not cover the Doxy PEP, that you would just pay out of pocket. It's a very inexpensive drug. So there are other ways of purchasing it without that insurance. And I would recommend if somebody is on that route saying, oh, I'm going to get Doxy PEP and I'm going to get this, then they're pretty likely just to go ahead and pay for it if their insurance is going to cover it. It's not very expensive. It's a very cheap antibiotic.
Okay.
awesome. Anybody else with other questions for Brett? Brett, we do thank you so much for bringing this forward and sharing it.
Absolutely. I've been very excited to share this. I was supposed to present last month and then something came up and couldn't do it. So I'm happy to be here today.
Sure, sure. Hey, I do have one question, if I can derail us for just a second. You mentioned PrEP. I ran into a situation last week. There was a law enforcement officer that was accidentally stuck and needed post-exposure prophylaxis. He kind of got the runaround. I'm not quite sure that the department he was working for understood that he probably should have just went to the emergency room. So he had reached out to State Service Center, and they had, basically told him, we don't have these drugs here. I don't know what you're talking about. Do you know since the medications are already essentially at the State Service Center, is the barrier for providing occupational exposure PEP that workman's comp issue, or are you able to elaborate on why there's not an occupational exposure route or pathway for PEP access?
I would say it's mostly because every employer that is exposed, or they have different policies. So
yeah,
whereas and it comes from the funding source. So for us, we're able to give NPEP because we have money that's divvied up for that care. Whereas somebody who is getting those drugs, they are very expensive. There's usually a procedure in place for that person to follow up. And it usually does not involve public health clinics, because we get the other issue where we have somebody who was exposed, and it was a consensual sex act, and they were exposed, and they've gone to the emergency room, and the emergency room denies them care. They'd say go to the health department, because typically the emergency rooms will only see patients if it's a case of rape or sexual assault. So it's unfortunate, but that's the way that is. And that I've heard this story for the last couple of years in Delaware. It may have changed. I'm hoping it may have, but for that police officer, yeah, it's tough to say exactly why we don't offer for occupational reasons or reasons other than what I outlined in our presentation. But I would say that there's usually very specific policies and procedures in place for when somebody gets exposed, and we don't really have a way of collecting money from organizations for the medications. So they have to follow their company policies for those scenarios.
Thank you. Anybody else? Questions? This is a good topic.
Yeah, I'm very excited about Doxy PEP.
Doxy PEP.
Yeah, and it's been a work in process, but we are finally up and running, and people can go and get Doxy PEP right from our clinics, which is extremely exciting.
I think it's amazing. One thing I will say, just because as an HIV/AIDS nurse myself, I always stress the counseling part of it, Doxy PEP too, right?
Yes.
Because we have folks that'll come into the office or to the clinic and say, oh, I need some Doxy PEP because I'm getting ready to go on this cruise or whatever. And I'm like, oh, I bet that cruise isn't in Alaska. I bet that cruise is probably somewhere nice and warm. And I don't know what's worse, the rash that occurs when you get all that sun exposure from laying out on the beach with the
Yeah.
doxy, or whether it's the the need for treatment for chlamydia or gonorrhea when you get back. So
Exactly.
um,
Yeah, there a lot of people think that you take Doxy PEP like you take PrEP, where you have to take it every day for it to be effective. And no, that's not the case. You only want to take it when you know you're going to have the sexual encounter.
great point. Great point. All right. Well, that's all we have for our committee meeting today, and I do appreciate everybody joining us. We were able to record it, so David should be able to join in and do any follow-up needed. Brett, we really do appreciate you joining our call today. And if nobody has anything else further, that'll give us 7 minutes back to our very busy holiday schedule.
Thank you, everyone.
Thank you so much.